Dr. Cislina Grosser-Ledbetter, Director of Counseling and Student Development at the University of the District of Columbia, and your host for A Healthy Mind. On today's edition, we will be talking about the psychological aspects of anger. My guest is Dr. Vince Greenwood. Dr. Greenwood is the founder and director of the Washington Center for Cognitive Therapy. The mission of the center is to provide short-term cognitive therapy to people suffering a variety of mood disorders. Dr. Greenwood has worked as a research associate and training leader at Johns Hopkins University and the National Institute of Health. The Washingtonian magazine recently recognized Dr. Greenwood as a top therapist in the following categories: cognitive behavioral therapy, generalized anxiety disorder, panic disorder, and major depressions. Welcome, Dr. Greenwood. Thank you so much for joining us. So we're talking about anger. I think it's a topic that we can all relate to, but we've heard that anger is an emotion, anger is a feeling, anger is a state of being. What is anger? Is it all of that and more, or what really is anger?
Well, it's an important question. It's certainly a feeling and an emotion, and that's the way all of us experience anger. Something happens, usually we feel like we're being treated unfairly or we're under some kind of threat, and we immediately feel angry. But we emphasize, particularly in trying to help people have anger problems, that it's more than just a feeling. It's definitely a feeling. When we feel like we might be threatened, that can set off what psychologists call the fight or flight response, which is the heart starts beating rapidly and you breathe rapidly, you get oxygen to your muscles, and all that might be appropriate if we're really in a crisis because we have more energy. So there's definitely a strong feeling that can get triggered very rapidly. But we also have discovered that when people are angry, particularly when they're very angry or they get stuck in anger, that it has a big component of thinking. It's not just a feeling, it's the way we're interpreting the meaning that things have. And that's a very important point because it means that we don't have to be victimized by things that happen to us. We, to some degree, create our own anger, or at least it's an interaction between something undesirable happening and the way we're perceiving it or interpreting it.
So hearing that makes me think that we can control it. I don't know that that's true, but where does it come from? If we are dealing in interpretation and dealing in the feeling, then tell me a little bit about where anger comes from. And I don't know whether I'm asking the question from a physiological perspective or a clinical perspective, but give me some idea of how it just shows up.
Yeah, well, maybe the first point should be it really is a basic part of human nature. It's something that we're born with, we're wired together for at least the capacity to get angry. When you see it in newborns practically, you see it across cultures. And there's a good reason. I mean, it has survival value, particularly way back when. It was important for people to be able to mobilize themselves quickly to judge a situation as potentially threatening or unfair and to have a lot of energy to deal with it, either to fight or to flee. And so it's got great survival value, so it's definitely part of our human nature.
So it almost sounds like what I hear is fear, no? Because I hear a reaction to fear when some of the things you're describing.
Yeah,
like,
well, we call it the fight or flight, and it kind of depends on the situation. I mean, it's definitely a lot of arousal. Some of the same things going on in the body are the same, and we can experience it as fear if we're threatened by something and need to flee, and we can experience it as anger if it's a situation where it looks like we might have to actually be aggressive and fight. But at a physical kind of feeling level, the same thing's happening. Our heart's beating faster, breathing more rapidly, our muscles are tense and tight.
And so that's a part of human nature that we use as I'm thinking primitive. You didn't say primitive, but I'm thinking a primitive mechanism that shows up when we need to respond to something coming at us.
Yes, no, that's a good word. It's definitely associated with the kind of the lower part of the brainstem, and the other part that goes with it is just a rapid fire appraisal. You know, if there's something threatening or even something that might be unfair, we have the capacity to make very rapid fire judgments. And again, that's helpful when there really is a threat or when we really are being exploited. Of course, the problem in modern times is that often it's an overreaction. We're not really under as many threats as we were in the past. So we've got this mechanism that has survival value, but it gets triggered often in situations where we don't need the full intense reaction.
Like what?
Well, in modern days, probably the most common situation where anger gets triggered is when we're being treated unfairly.
Okay.
Now, that's not trivial. That can be very important depending on the situation. But rarely do we need the full, intense, mobilized to fight. Occasionally we do, when we're actually being threatened. But the great majority of time, we really don't need that intensity.
And that's how you're defining the state, is the intensity that we experience it sort of physiologically, when our body is feeling it and the feeling that we have. And then you mentioned something about the thought that goes into it. So is that the intersection? Is that where we treat it? Is that where we identify the mechanism by which to control it? Is it in that thought piece that you talk about?
That's a very important piece, yes, because there's the feeling, there's what's going on in our body, but then there's the meaning of the event that's getting us upset.
Okay.
And it's the meaning and the way we think about it and interpret it. And if we interpret it in such a way that we feel we're being treated poorly, which is usually the case with anger, then we can, that can really intensify the anger.
Okay.
Yeah, and we've identified a number of the, I guess I would call them problematic ways people can think about situations that kind of take the anger to a really high level where they can end up doing things that are harmful that they later regret.
Right, and that's kind of my next point. I really want to know, how do you distinguish between anger just as a state and as a healthy way of using the feeling, between that and when anger is problematic? So I guess you see maybe the range when people can, in a safe place, be angry at whatever the situation is, and you probably also see the other side, which is a person who has a problem with anger. How do we know when we have a loved one who has a problem with anger?
Yeah, well, the problem almost always comes in when the anger, the predisposition to feel angry is something we all have. So that's nothing to try to get rid of. The anger is kind of a signal that something really may be wrong. Now, the key thing is that we don't act on it right away, that we use our reason to try to determine whether we should act on it. People that have a problem don't go through that process. They kind of can go from 0 to 100 miles per hour, and before they know it, they've done something that they regret and that may have hurt a loved one or gotten them into trouble at work. So one way in which anger is a problem is when it's too intense and when it just goes to a high level.
Okay.
Another way in which anger is a problem is not so much the intensity, but there's a subgroup of people with anger problems where it's that they're feeling angry too much. It's the frequency. And we kind of label that hostility. That's the person that kind of goes through the day or goes through the week. They're just always on edge. They're kind of ready to get upset about almost anything. And this subgroup of people tend to have very high demands of themselves, but also of other people. So while we all might get annoyed in a traffic jam, for example, someone like this would really get angry. Okay. So there's too frequent is when anger is too frequent, that's a problem. And of course, the key questions we asked are: have you ever done anything that's upset a loved one? Is it harming your personal relationships? Have you really the focus is on the behavior? Have you behaved at work in a way that's harmed your relationships at work or jeopardized your career?
And what do we know about these people? Do we know anything about the triggers? What I don't know exactly where we might go with this piece, but what do we know in terms of why people have this angry disposition as opposed to the ability to think their ways out of it? Do we know anything about them? Are they trauma victims? Are they born this way? Is there a kind of chemical or physiological disposition to be that way? Do we know anything about?
Yes, we do have a lot of answers, and you've touched on let me just say it's complex. They're all different kinds of subtypes, and you touched on some of the key ones. So some people are born with the predisposition just to be more emotional. You know, they tend
Emotional, not necessarily
not
angry.
necessarily
Okay,
angry, but to
emotional.
have that fight or flight response
gotcha.
get triggered. You know, some people are just born more that way. It's not necessarily good or bad, but it's important to know about yourself if you have that, because you may have to develop certain coping mechanisms. You mentioned the word trauma.
Yeah.
For us, again, this is just a group of people that have anger problems. You're asking how anger can be a problem. For some people, anger is a problem when it's misdirected. And that's often the case with trauma victims. If someone has experienced trauma, usually earlier in their life, a natural response to trauma is to get enraged or angry. It's a real violation.
Right.
But often when, particularly if you're a child, you're not really allowed to get angry, or you just get punished for that.
Right.
So then when people get older and they have relationships that aren't traumatic, that aren't, let's say, abusive or something, they're still left with this kind of fragile sense of themselves and of relationships. So when they see something in the relationship that even gives them a hint that the person might be untrustworthy, or they might be going down the road toward abuse, that can set off their intense feelings. And in that case, it's kind of inappropriate, unfortunately.
Right.
So sometimes with trauma victims, the problem is to recognize where it comes from and to encourage them to try to hang in there with current relationships. They might jump to the conclusion that they're going to be victimized again,
Right.
but they may not be.
Right.
Yeah.
But you could be walking right into a trigger.
Yeah, that's right.
And not realize that you're triggering an angry response from someone who's been abused or someone who's been traumatized in some other way.
Yeah.
And you unwittingly or unknowingly say something or do something, and then that person does the 0 to 60
That's right.
in
That's
2
right.
seconds, and
Yeah.
you're like, woo,
Yeah,
what just happened here? I
Yeah.
just said you look nice.
Right,
And, you
right.
know, so
Yeah.
I wonder if, wow, it sounds like there's a lot of work that would need to be done with someone who has whether it's a predisposition or whether it's a response to trauma. How do you help someone who's had that history of trauma or anger, or they've become used to that response, or it may be for some reason it's worked for them? How do you help that person? And I'm sure the answers may be varied, but I'm real curious on how you can get work
Yeah,
done.
the answers are varied. So let me talk about how you might help someone who suffered from trauma.
Okay.
And then I think there's a larger group of people that just straightforwardly have a problem with anger, and I'll talk about maybe how to help them.
Okay.
Yeah, so with trauma, the problem is that their fight or flight response is getting triggered with people or relationships where it really perhaps doesn't have to be triggered. But again, they've been traumatized, so it gets triggered easily. So one of the foundations of treatment is to develop a clear awareness of that.
Awareness.
Yes.
So key.
Yes, so key, because they can't immediately control their feelings getting triggered. But if they can then quickly kind of remind themselves, well, it's understandable this got triggered given what I went through younger. I know that I'm afraid, whatever what the trauma was, I'm afraid I'm going to get abandoned, I'm afraid I'm going to get abused, whatever it was. But let me just really try to focus on what's happening with this person and really see if they can challenge their thinking that it's inevitable that it's going to happen here.
Wow.
So you really help them kind of hang in there, really evaluate whether this relationship is a repeat of an earlier relationship. Hopefully it's not.
Right,
Usually it's
right.
not.
Usually it's not.
And so then slowly over time, they begin to have this emotional correction where they begin to react to the current relationship kind of the way they should react.
And
It's
you're not
appropriate.
talking about a short process.
Right, no, that for someone with trauma, that's definitely time. They're vulnerable, they've got a fragile sense of themselves, and it's going to take a lot of work to do that. But that's the essence of it, is the awareness
Yeah, I
and
really like
hanging in there with the person.
Right.
So many people, you know, at the first sign that they might be in a abusive relationship, bolt, and then they end up alone. So
Right. Which is interesting because you're defining this as in the context of anger. which is relevant, but I wonder if individuals who end up fighting and flighting out of relationships realize that that's what they're responding to. And I think the key point that you mentioned that resonates with me is the awareness, is being able to recognize it, to call it what it is, and to seek treatment.
Yes.
So I'm curious about what about those, the whole group that happen not to be experiencing trauma. There's a whole nother subset that you talked about, their treatment, how they would deal with anger.
Well, the essential point that we drive home right from the beginning, first of all, is that they have some choice. Not the choice to get rid of all their feelings of anger, but a choice about how they behave. Because if they're coming in for treatment and they have anger problems, it's almost always the behavior. And so while you might not have a choice on getting angry, you do have a choice on your actions and how you behave. You also, and this takes a little more time and effort, you also have some choice over your thinking. And so we, as a start with such people...
That's a lot of work.
That's a lot of work, yeah.
To tell someone they have choice over their thinking?
Yeah.
That's a really powerful concept.
That's right, yeah. And that's our job as clinicians to really try to lay that out. You know, that's our job to kind of show them how. Well, the first step is awareness again. What are their thoughts that go along with the anger? What are the triggers? What's setting them off? And what we found with anger is that it does boil down to a few basic beliefs or attitudes. Almost always when someone has an anger problem, yes, something upsetting has happened to them. But to really get an anger problem, again, it's an interaction between what's happened and the way they're thinking. And the thinking that's problematic is what we call, it's like making a judgment or an evaluation. And almost always the judgment that gets the person to the high level of anger goes something like this. It might actually pop up in their mind. Usually it's just kind of a silent assumption. What they're saying is, this just shouldn't have happened. Not that I don't like that it happened, but it just shouldn't have happened. Whatever this is, you know, the person treating them unkindly, getting caught in a traffic jam, the computer glitching, whatever the situation is, it's awful. So they kind of characterize it in their own mind as awful, not just lousy or undesirable, but awful. There's usually kind of a judgment of, I can't stand this. This is just unacceptable. So that takes them to a high level of anger. And then there's often what we call polarized or black or white thinking, is that they're characterizing the person or the situation in all or none terms. You know, they're nothing but disrespectful, let's say. Yeah.
These prepared thoughts, these judgments, these perceptions, they're at the ready.
Yes, yeah.
So
rapid fire, automatic.
It's kind of like no matter what you say, they're at the ready. And it kind of reminds me of a woman kind of getting dressed and saying, do I look fat in this dress? And bringing whatever anger or whatever body image issues she may have and lashing out at her husband. And, if he doesn't say the word, then he must think she looks ugly or she looks fat. That is a minimizing kind of what you're talking about, but it reminds me of how we have sometimes these
programs.
Programs, and they are just ready for the next victim.
That's right.
To come along to say the wrong thing, and
that's right. It's very rapid, very automatic. It feels involuntary, and it is in a way involuntary at first. But part of the treatment is kind of a little bit like this conversation, is to educate people that they are having these silent, they're usually silent, sometimes it bubbles up in their mind, but silent judgments. And that is empowering potentially, because it means that they're not simply the victim of anger happening to them, that they can have some say, not 100%, some say on their level of anger by examining these judgments.
Is it possible to self-treat? Is it possible to bring the awareness to yourself? I mean, when you have an anger problem, or if you have a loved one with an anger problem, is there ways that you can support this person that may not be ready for therapy yet, but sort of to prepare them? How can you get them to do things on their own that make them aware that either, that they're using anger?
Well, yeah, fortunately in this day and age, with the internet, there's a lot of self-help material on anger.
Okay.
So if a person, a big problem with anger is just getting them through the door to acknowledge that there's a problem.
Yeah,
But
that's
if they're
huge.
not ready to come through, let's say, a therapist's door, but they're encouraged by a loved one, or they themselves recognize they need help, there's definitely there's some very good self-help books. And these newer treatment models, the models that I've been trained in, the cognitive behavioral, do lend themselves to self-help. I mean, they tend to be pretty straightforward. There's a lot of good exercises. So yes, there definitely is material.
So I wonder if, sort of looking at on the other side, so we all feel anger, and that's not necessarily a bad thing.
Right.
What about those who over-control for anger, who never express that they're angry? I don't know whether that would be a cause for concern. Someone who is always composed, someone who never experiences anger. Is that a cause for concern, or
well, it certainly can be. Yes, as you were saying at the beginning there. There's a reason sometimes we get angry. It can be an important signal. Some people would use the word emotional intelligence. It's important to not suppress your feelings, not necessarily to act on your feelings, but definitely to be aware of them and to read them, to see if there's something legitimate in them. So people that suppress that can be a problem. And many therapists, and in my office too, we do see people with that problem.
Okay.
And so that is really the opposite end of the spectrum. And almost always, what you find is, they grew up in a family or a subculture where they got the message that anger is absolutely unacceptable. They may have been in a relationship where it got punished, so they've just learned that they're not allowed to express it, and some of them take it so far as they're not even allowed to experience it.
Wow.
Now, so they miss a lot of signals, and then as you can imagine in a relationship, that can really be a problem.
That can be
because
devastating.
Anger and disappointment and hurt, they're a natural part of a relationship, and if you don't allow yourself to have that experience, then often in a relationship you're going to end up very much on the side of being unassertive, being kind of out of touch with your needs. And
yeah, and so I'm thinking about what your role would be then, and how you have to teach people how to experience anger in a healthy way.
Yeah.
So it's not quite the idea that you can, and I'm thinking about the alcoholism, that you can't not have another drink. But you can be angry, but you just have to understand how to express your anger, so that you don't go out and get into a whole heap of trouble that you could potentially land yourself in, because you haven't been taught how to program to use that thought.
Yes, right. Yeah, and for people that are over control,
Right.
that have a hard touch allowing anger, it's kind of a two-step process. One step is you want to help them identify the messages they're giving themselves that say you're not allowed to have anger or express anger. So that's one step, just so that they can feel that they're entitled to even have the feeling. Then, as you point out, then there's a whole issue of expression. Now, for the people that are over-controlled, frankly, rarely do they swing to the other side. They're afraid they're going to swing to the other side and express it.
Right.
But normally, if you encourage them to experience their anger, usually you have to encourage them to express it more forcefully. For the whole other group that we've been talking about, there it is an important issue to try to provide guidelines and directives as to how to express their anger, because their difficulty is much more in reining it in. And there are some good guidelines that you can give people when they feel it is appropriate to express anger, to deal with something that are designed to convey respect to the other person. They don't guarantee things are going to work out, but they really raise the chances that you can have a good give and take. They're designed to try to help the person feel some respect for themselves, that they feel they're communicating in a way that's both respectful to themselves and the other person.
Yeah. That's absolutely great. I wonder, I'm kind of thinking about the person who says, I never get angry. and I don't want to get angry. And something you said just reminded me that these are the people that sometimes say, if I get to this point, I'm going to blow.
Going to explode.
You know, I'm going to explode.
Yeah,
and I
right.
bet there's some truth to that, because you tend to, I imagine these people tend to repress their feelings of anger or their feelings of discomfort, and they don't feel that like they have permission to feel that way.
Yeah,
And
like
so-
steam building up
Yeah.
in a teapot. That does happen occasionally, yes.
Yeah.
And so for those people, it would be useful to both give them the message that they're entitled to anger, but also give them some guidelines about when they do start expressing the anger, to do it in a way that, again, that they can feel some assurance it's not going to be harmful, it's not going to be a blow-up.
Okay.
And a big thing there is to express the anger earlier rather than later. Try not to let things build up so much.
Wow, that's
Yeah.
great. So we have about a minute left. Is there anything that you'd like to sort of end with in terms with the resources that you have? Any last thoughts about anger that you'd like to share?
Well, I just would want to emphasize what you asked earlier. There are a lot of resources, and people are welcome to call the center, but it's certainly if you Google anger, there's some excellent authors, both on the web and with self-help books. And I just would want to say to people that if they're worried about their anger, they are not helpless, they are not powerless.
that's great.
There's many things that can be done, both in terms of changing their thinking so they don't get as angry, and certainly in terms of curbing their behavior so they don't do something that they later regret.
That's great. And the awareness is the first start. That's
Yeah.
where we begin,
Yeah.
is the awareness. Thank you so much. I would like to thank Dr. Vince Greenwood for being my guest. If you would like more information on our topic, you may contact Dr. Greenwood at the Washington Center for Cognitive Therapy, or visit their website at www.washingtoncenterforcognitivetherapy.com. I'm Dr. Cislina Grosser Ledbetter. Thank you for watching.
Thank you.